bone marrow is a factory that normally makes all the blood cells we see in the blood.
The red blood cells that carry the oxygen, the white blood cells that fight infection, and the platelets that make the blood clot.
Bone marrow contains stem cells that are the mother cells that form all of the cells in the blood. The bone marrow is always producing more blood cells from the stem cells. If the stem cells are damaged, they can stop functioning normally.
A lot of times our patients have a disease or a malignancy or a condition that makes their bone marrow not work, which means that we have to find a way to replace their bone marrow and make it work again.
A bone marrow transplant allows us to completely eliminate the bad cells in the marrow and replace them with healthy stem cells.
Most of the population that I help with bone marrow transplants are patients who have leukemia, lymphoma, multiple myeloma. They could also have aplastic anemia or sickle cell. So it's mainly patients who have blood disorders.
I thought that, hey, I have sickle cell anemia. It doesn't have me. You know, I can survive. I can do this. Man, I don't need your transplant. I got this. I didn't have it. It was hard. It was rough. And as the hospitalizations started getting more frequent, it started becoming more and more apparent to me that a bone marrow transplant was my best bet.
We evaluate patients very carefully before committing to the transplant, making sure their heart, their lungs, their kidneys are all strong enough to allow them to get through the transplant successfully. There are risks, as with any serious medical procedure. We can improve the success of transplant by doing everything we can to find the best donor.
Before I was diagnosed with leukemia, I knew that there were bone marrow transplants. I had the same misconception as a lot of people at that point.
Many patients come expecting there is going to be surgery.
I thought it was drilling into bones and extracting marrow and things like that. I had no idea that what a stem cell transplant was.
It's the actual day of the transplant. It's a little anticlimactic. They, have this countdown to transplant day, and they talk to you about how exciting it's going to be to have your transplant, and it's just hanging a bag of blood and letting it run in. It's nothing really exciting.
The transplant itself is really a lot like a blood transfusion.
The curative part of the transplant is actually the pretreatment. That's what kills all the cancer cells wherever they might be in your body.
In my case, I got high doses of chemotherapy. Some patients get radiation therapy.
For whatever reason, their old bone marrow isn't working. So we give them this high-dose chemotherapy, and sometimes including radiation, to kill it off. And so those old bone marrow cells die, and they actually leave the body, and so they're making a space for the new cells to come in.
Well, imagine that you have a garden with weeds in it, and you go to the garden store and you get some Roundup. The Roundup kills the good and kills the bad, and then once the Roundup is cleared from the dirt, you plant new seeds.
Sometimes people think that, you get the transplant and then the process is finished. But really, getting the transplant, the actual infusion of the cells, is really just the beginning of the healing process.
The transplant itself is the recovery. They bring you back with the donor cells and rebuild your system after it's completely wiped out in order to kill all the cancer.
The aftermath of the transplant, probably the most dramatic phase, is the first couple of weeks after the transplant, and during that time the patient may or may not be hospitalized, but there's what I call the miserable period, and that's the period when the patient feels the effects of the chemotherapy and radiation that are given.
Having a supportive family is very important. It's a long procedure to undergo, and patients need help getting through it. Having a family member who can be with the patient in the hospital room throughout the transplant hospitalization makes the transplant safer.
So the first big milestone of a transplant is engraftment, where we see that the donor cells are growing in a measurable amount in the patient's blood.
As the donor cells engraft, as we call it, we begin to see the red blood cells, the white blood cells, and the platelets recover to normal levels. So that's our first sign that the transplant is successful.
But they've gone through a life-changing procedure. We want to take patients back to a state of health, but their lives are going to be different. We partner with them for years after the transplant procedure to help them through that journey.
we're in the process with them. And we're there to support them, we're there to help them.
When I see a patient come back to my clinic 5 years, 10 years after undergoing the transplant procedure, they're back at work, they're with their family, they're feeling well, I count that as a success.